Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, and here with me is Dyan, a healthcare patient engagement savant with many years of experience. Dyan, please go ahead and introduce yourself.
Hi, Cole. First of all, thank you so much for having me. I am Dyan Bryson. My consultancy is called Inspired Health Strategies, and this has grown up after more than 30 years in the pharmaceutical industry. I was a typical sales, marketing, sales leadership person, launching brands, and sad to say, as I look back, I really didn't do much for patients. It took a project that I did with a drug company that asked me to come in and do a community-based effort. And I was able, okay, since I'm as a Black person in pharma, especially when I started, there were very few Black people, let alone women. So I was always asked, can you help us out with the diversity thing or the multicultural thing, in addition to my real job? So I saw all kinds of efforts that were not well funded and just about checking the box. In this case, this pharmaceutical company was serious. They were investing $3.4 million dollars. And since the program was going to be around the patient, putting the patient at the center, they had no hopes of making any money at all. Because of course, when we talk about patients, we're talking about altruism. Well, we returned more than $100 million dollars. We helped to improve relationships between patients and physicians. We thought all the physicians just kept seeing patients at a fast clip, not a lot of time, because of course the payer pressure and any corporate pressure, and that is still true. But we also learned that the physicians will give the patients more time if they see that the patient's actually becoming to doing what they're supposed to do and being an empowered patient. And so that with that model, I couldn't go back to the typical marketing. And I figured, wow, this is a great business model. It worked out for the brand, it worked out for the patient. Why aren't we doing this? It took me a year pounding through this industry to realize that nobody was doing it. So since that time, that had to be 15 years ago, I have just been pushing and finding opportunities where I could. And I feel like I guess I'm really pushing a rock uphill in an industry that wants to put the prescription at the center and not the patient. Things have happened over the years where there have certainly been patient centricity efforts, and they've been, again, check the box, but I've still been in there and making sure that we had KPIs and they could see that there was a business value to this, as well as a value to the patient. And now, fast forward to COVID, helped everybody realize we were not putting the patient in the center. And so now everything that I've done has become important to my clients or potential clients. And I'd say then that the way that I learned was through hard knocks and being hard headed.
I have to ask, that's an incredible experience that you've had with that realization. Why aren't we spending money on patients? Why are we spending money on prescriptions? I don't understand.
Well, when we're spending money to get the prescriptions, because it's easy to see whether or not the prescription is filled. We don't have any way to measure. And that's where even one of your questions talking about technology. We don't have accepted ways of measuring what happens with the patient once that prescription gets filled. It's easier to measure what we see. And I remember someone being incredibly clear with me about that at one point when I was very frustrated. But that's probably the bottom line. We don't know how to measure it. And then also, I think, and what I'm seeing now, I think it takes a change in culture in a company. I've seen one company I worked with, the CEO went into the hospital, and he's a CEO of a pharmaceutical company. So there's nothing he needs to learn going into the hospital. He knows everything. And he got there only to realize, oh my God, this is what it means to be a patient. When he finished his stay, he came back to his company and he changed it. And that's what it really takes, a real change in mindset, a change in culture. It usually takes champions within a company to really decide that they want to fight for it. I can think of, do you mind if I name any companies?
No, please.
Okay. So I can, and as I say that, so one company that I didn't work directly with, but I've gotten to know and got to know the story of is Astellas. Astellas is a Japanese-based pharmaceutical company, and they had thought that they were being patient-centered until they hired a consultant, a physician consultant, to look at all the ways that Astellas was measuring how it is patient-centered. And the consultant came back and said, those things that you perceive that are patient centered, that are helping with patient engagement, help with your own engagement, are not helping with patients. So the person who managed that process internally had enough heft within the company to go to the executive board and say, look, we need to change how we're doing things. And so again, there's that champion in the company. And that had to be 4 or 5 years ago. Since then, Astellas has been just trudging away, trying to ensure that everything that it's doing is patient centered. And so, again, that's what it takes, a champion inside who wakes up to the fact, yes, we're getting the prescription, and that's important, that's the business, but we can serve the patient at the same time.
I guess what worries me a little bit too, or what probably worries some of these executives, is like you said, it can't necessarily be measured, or it couldn't be measured. What are you using? Are there new technologies? How are you measuring the success of these initiatives?
So I have within pharma, we depend on companies like IMS or now IQVIA to give us data to let us know how we're performing, whether or not what the prescription behavior is like. And that again, that process is not as clear for patient data. Even using claims data is not as reliable. However, you can start to measure adherence rates, and there are ways to do that. And way I've seen it work best is using some kind of platform, but because it's and that though is at the individual level, and you have to have patients who are using that platform. But I think adherence rates come down to it, and then also it's a perception. What is an adherence rate? I've been in a meeting where the patient support team is telling the C-suite, we have great patient adherence. And they said, we know that we do because we have delivered the drug to the patient's house. No. You have no idea if the package was even opened. You have no idea if anyone took the pills. You have no idea. So if you don't have two, and that's actually another way that you can start to see a difference in adherence through the patient support centers. If you have a two-way conversation with people and ask people, did you open the package? What was your experience? And stay engaged with them instead of just throwing the drug at them and just waiting for them to get another refill. And that's where most patient support programs are right now, unfortunately.
That is, I've had experiences working in neurology. And then, of course, in population health, we see the metric side of that. But in neurology, you actually see like what the patients are actually experiencing. They can't always remember if they took it. They don't even, I mean, one time this patient was having this terrible time and figuring out whether he took it or what the medication was. And the doctor said, okay, let's look at it. And they poured out the pills and the doctor's counting them. I mean, sometimes that's what you need to do, but
Sometimes,
if you can just check off that box from a metric perspective and say, "Oh, he took it," don't worry about it. It's very very interesting. So I guess what I'm wondering is, you said that this company they changed their approach. They
mhm.
had great revenue, great pro. It went well financially. How often is that the case? Is every time we take a patient focused approach, does it result positively, or are there some times where there are losses?
I think there are times when there are losses, and usually those are the times when we are not engaging with people and asking them what works for them. That we're making assumptions. Let's go back to the pill counting. You're right.
Yeah.
Sometimes it's not, even though I can give you an app and that has a timer on it and you can check it off. That's not good for everybody. You have to reach them in the channel that works for them. And
Mm.
I believe in every single channel possible, and not make the assumption just because someone's older that they're not going to use technology. There's going to be younger people who won't use it too. But
Yep.
usually, whether or not you use technology, whether or not you have a nurse that checks in with people, whether or not that doctor sits down with them and counts the pills out, as long as you do it from the patient's perspective and not make assumptions of your own. One of your questions was, what are the components of good patient engagement strategy? The first thing is to ask a question and listen, and actually
Mm.
listen. The patients are the experts. um, there's this whole other component. It's not just about taking the pills, it's about also what's going on in people's lives. So finally, now, when I first started at this, there was no term for this. But thank goodness public health has come up with a term, the social determinants of health. I used to
Hmm.
say there's a formal healthcare system and an informal healthcare system.
Yep.
The informal healthcare system is the social determinants of health. Whether or not the person has a steady home, whether or not the person has a job, whether or not whatever's unsettled in their lives is can be managed, and we have to also take those things into consideration. I'm frustrated when people build initiatives based on a static patient journey. That patient journey is not static. It's like a shooting ladders table, a game. It changes all the time. And if we make decisions, and I've seen this, where we make decisions based on the patient journey that someone did like a year ago, no, it's not. It has changed. Even as I am a cognizant patient, I hope, if and I have a couple cats. If one of my cats get ill, the journey I was on before they got ill, I was good. But then now they're ill. Can I afford to take care of them? Am I going to find the right resource to take care of them? I'm off my journey. So everything that you collected about me as of before I knew that they were ill is now wrong. So again, that means you have to communicate with people to understand where they are, understand what else is going on in their lives, and take those things into consideration.
One of the questions I had that relates to that patient journey is never really unique. I asked, what can providers do? I guess another kind of question on that is, how much should we tailor things? What are different ways we can tailor things to each patient and each experience, and how much is needed? Do you know what I mean?
I know this is where the investment comes in. I think it depends on the channel that you take. There are two apps that I really like that have ways of people interacting so that it's not just one way. And they can interact not just with the provider, but they can interact with other people like them. One is Health Storylines, and the other one is now included from a company called Acclinate. And that those two apps allow the patients, the users, to customize their experience for themselves. So they're not dependent on us pulling any levers or making any changes. They make it so that the user experience is positive for them. And then with that, they're more apt to stay with the app for not for initiatives that don't include platforms. It's really still asking people along the way, taking a pulse check. For instance, if in a doctor's office they put it one, this was a wave at one point. It looks like it's coming back. That doctors would put televisions in the office in the waiting room so that people could learn about their diseases or learn about drugs, probably in the office, learn about different things in the office, and and that's great. But how about if somebody shows up who can't hear very well or doesn't see? Do we have anything to adapt for those people? And are we asking, will we put a TV in the office? Do you like it? Is it of any value to you? What have you learned from it? And ask them, what more could we share? What more could we do to make this experience of waiting more not enjoyable, but more pleasant.
Sometimes, with the population health metrics, it can make it really hard on these small institutions. And kind of what you're saying, I really appreciate from a big institutional perspective, like, yeah, let's put a few $1 million into this. Let's, really ask our patients how they feel. We could hire people to do that. That's not really a problem. But these community access hospitals, which have 100 employees or, even 1,000 employees, that is a huge, monumental task for them. What, I guess, as a consultant, do you tell some of the smaller organizations you work with, if you do work with, the smaller pharmaceutical companies, how are they able to do things to raise their patient engagement levels and raise the accessibility levels?
Oh, interesting, because I was thinking about it from a doctor's perspective. So I'll share that first. I'll share the office experience first. What I find is the engagement in the office can be better. You have to do some data intake, and many times they're using an iPad. Therefore, the intake person's eyes are on the iPad and not on the person, and they feel shut out. Just that one simple thing of changing that, maybe bringing in someone who could take the notes and one other person ask the questions. And that even could be a volunteer. But there are people who are out there who are scribes who are there just to take notes. Therefore, the healthcare provider can engage directly with the patient. It's,
I actually have seen that at the ED down
mhm,
at the
mhm.
ED here in Center City, and that's incredible. I have never thought of that, but I've actually seen it, but I never connected that. So that's a great example.
Somebody's asking you questions, they're critical to your treatment, and they're not
Yeah,
looking at you. And then let's
yeah, that's
add
crazy.
in people of color who are used to not being seen, and what a wall that puts up, you know?
Yep. Wow.
So for pharma, for small companies, I have found, okay, for instance, let's see, I was working with one company, a small biotech, and they were going to do some patient research, their market research. They're preparing for a brand to launch. And I said, look, I can help you with that. I work with advocacy groups. I can set up focus groups for you. And they said, no, 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 no. I'm going to talk to the doctors about the patients. Well, let me tell you, the doctors don't know fully about the patient's experience. So, what I did in that case, since I had such a good relationship with the advocacy groups, I was able to set up a global focus group, basically, where I got people from the advocacy group, caregivers, and patients on a call with people from the pharmaceutical company. This costs
Mhm.
no one anything except the use of the technology to run the
Yep.
teleconference. And we were on a path at that point of developing a drug for an ultra rare disease where we were concerned about how it tasted and how it smelled because it stunk to high heaven and it tasted poorly. So the pharmaceutical company was in the process of making sure that the tablets were hard and enteric coated, could not be crushed to improve the patient's experience. We did this focus group, and they were reticent. The company was reticent, but I ended up having almost every stakeholder, almost every silo in the company sitting in listening to this. And they heard the patients and caregivers talk about how they use feeding tubes. They don't smell or taste anything. 80% of our potential audience has a feeding tube. Smell and taste means nothing. So the CMC folks, the pharma folks in charge of formulation, went back and said, "Oh my God, we're on our path to serving our audience, our patients, and our shareholders, and we're going to go to market with a drug in a formulation where we can only serve 20% of our patients." Wrong. They didn't realize, okay, just that small time, an hour of listening to patients and understanding where they really are, what their lives are really like, if they didn't do that, they would have completely missed the boat on for both the business needs and the patient needs. They did end up making this into a syrup so that so patients could easily put it in a feeding tube.
Wow. That's that's very interesting. So that's huge returns for them then. They
Yes,
were
and it
actually able to have a product that worked.
cost them nothing.
Wow.
Again,
Um,
just this process of finding a way to ask people what's good for you.
how I'll leave you with one question because we're trying to keep these under 20 minutes, but I really want to get your perspective on this. If you had to give advice to someone like me, I'm very early in my career, but I want to make this impact on patients. Through all your experience, what's a little bit of advice you could give to somebody like myself so I could make this impact?
So first, I would look up this organization called the Patient Program at the University of Maryland. They help industry and researchers connect with communities, connect with patients, and build the tools to learn how to really connect with people, how to communicate with people. It's a free program because it's paid for by the sponsors. And you apply to the program. The patient program decides whether or not you're in. It's about a 5 week certificate program, but it's an eye opener if you haven't had this experience. And they run that program right now. It's once a year. As a matter of fact, we're in March right now. They'll be sending out applications for that program probably starting in April or May. That's where I would start. Then I would start. A lot of this is going to be volunteer, and that's what I did. I didn't make a lot of money. I just found opportunities to learn and understand. I mean, start working with some nonprofits who focus on patients, who really get in there, not just the big advocacy groups, the smaller mom and pop, probably advocacy groups that could really use your help and are not well funded. Usually, this is in the rare disease space. They would be glad to have your help, and you would be able to learn at their knees. Another organization is probably Global Genes, and that's GENES. They represent all of the rare diseases. They aren't therapeutic area focused, but they work a lot in training people, training advocacy groups on how to serve their patients. Those programs have some cost attached. I'm not sure where they are right now, but I would definitely look them up. So those are places that I would start that are easily accessible, that I don't think will cost a fortune.
And like you said, it takes a few years of that volunteering, not making a lot of money, but then you've been able to have a huge impact on countless people's lives and lots of organizations. So it does pay off.
It does pay off. And I'll tell you, Cole, I never remember that until someone like you says that to me. And people say that to me. And all I'm doing is what I think is the right thing to do.
Hmm. Incredible. Thank you so much for your time, Diane. I couldn't be more appreciative. And hopefully we can have you back on again to talk about more in-depth topics as I become more knowledgeable in this area.
All right. Thank you so much.
Of
I really
course.
appreciate it. You were great.